Welcome to Malpractice Podcast.
So, are you ready to get started?
Absolutely.
I'm Jess.
I'm Sydney.
And
this is Malpractice.
I couldn't say the word podcast today. I said, this is Malpractice.
Podcast.
Popcorn. Malpractice popcorn.
Malpractice popcorn that's all I've ever wanted.
Truly, we should get some. Yeah.
Absolutely. I love popcorn so much.
Sounds great.
What's up? What's new?
You know, just thriving. Surviving, really.
Thriving and surviving. That is exactly what you're doing.
Yeah, seriously.
Getting things set up for your impending bebe.
Things are set up. Things are ready to roll.
Yep.
Just a reminder, y'all, we're taking off May, but we'll have 2 episodes in June.
Because Jess will be in the process of giving birth to a human being.
And Sydney's going to start her job.
And you need a break for both of those things.
You do!
So thank you for your patience.
And if you're not patient, thank you for pretending.
If you're not patient, we have an extensive back catalog that I suggest you check out over the last 3 years.
Go listen.
And also,
mind your business.
Grow up. People have shit to do.
Yeah, people do have shit to do.
Like give birth.
Yeah. I discovered that for some unlucky people, first of all, there is like something that you can develop during pregnancy that's like extreme vomiting.
And you have that for sure.
It also comes with like dizziness and stuff. So I don't know if I have that or at what level on the spectrum of that I have, but my first trimester symptoms are identical to the second or the third trimester for me.
Yeah.
So we're back to that.
And I feel like the second trimester was good, not great.
Yeah,
right?
It was fine. There was still some vomiting.
A lot of people have told me that the second trimester you feel really good. And I'm like, I happen to know a woman who...
I know someone who says you're full of shit.
I happen to know someone who hates you.
Yeah, look, that is fact. I don't even have to know you. I do hate
Guarantee. If you say anything about how you feel great during your pregnancy, or you feel magical, or you feel beautiful, Jess wants to kill you.
The only magical moments are whenever the baby moves. That's cool.
Yeah, that's super special.
But that isn't all the moments.
Yeah, that's not all the moments. And vomiting for you has been a lot of the moments.
The blood vessels on my face, they might as well just like stay popped at this point.
So, not everyone is aware of this. Jess has been puking so hard that she has popped blood vessels in her eyes.
Oh, yeah. Under my eyes, too. I didn't even know you could pop them under your eyes.
I did not either.
Well, you can.
I am unwell.
I have done it today.
Today.
And yesterday.
Right before this recording.
Yeah.
So if you're still not patient about the fact that we need time off, Jessica's popping blood vessels under her eyes.
For you guys.
And there you go. And that's that.
Sydney went to a really beautiful, fun, cool, amazing wedding.
Did we talk about that last week?
I don't think so.
I can't remember. Okay, so I went to a wedding in Cancun. This is part of my family that's Bolivian.
Super cool.
Which is cool and fun. And they're like the most fun people. If you have a chance to make friends with Bolivian people, highly recommend it because a Bolivian wedding is the most fun thing you've ever been to. Yeah.
Yeah.
So it was at that part of the night where like the wedding is starting to taper down at like, 9 to 10 p.m. Everybody's like, okay, we've been dancing for a couple hours. We'll sit down now. And then these girls come out in like full carnival outfits, like thongs, feathers, headdresses, and they start passing out like glow in the dark stuff. And we're like, oh, that's fun. And then they pull out a limbo stick and a girl in a like butterfly flowing costume on like 10-foot stilts starts coming out and pouring shots into people's mouths.
Oh, hell yeah.
And I want you to know that Eric finished in the top 4 in the limbo contest.
So I saw a video, I think your mom posted, of his success and then his ultimate failure.
Downfall. Yeah.
But it was amazing. I didn't know he was a limbo champ.
I think he's only a limbo champ if he's like 6 shots in.
Oh, yeah.
Yeah.
Was he also a champion at the butterfly shot pouring in your mouth?
He certainly was.
Man, you can't. Eric is a good time. Catch him on the right night.
Eric was having so much fun that the bride was, like, pulling him up on the dance floor to, like, teach him how to do bachata, like, Latina salsa dances.
Oh, Eric.
This is a whole new version of Eric that no one knows.
I knew he had it in him, though.
He was the life of the party, and the next day, everybody was like, "Your husband is fun."
At the right wedding, Eric will bust a move.
He certainly will. He busted a move at your wedding.
At your wedding?
At my wedding?
At your wedding, he was a bop. Offs.
Yeah.
At my wedding, he was the dancing queen. Let's be clear.
He's a wedding type of guy. You bring Eric to a celebration of love, he is there
He is.
to party. Yeah.
He is.
So that was really fun. Congrats, Nicole and Rodolfo. It was a lovely wedding. Eric literally went up to the bride and groom and he was like, "This is the most fun wedding I've ever been to."
Don't believe him. He says that to everybody.
He does.
Just kidding. Just kidding. It looks so fun.
Yeah, it was really fun.
And your mom and dad went too, which is also always fun.
My parents were there. I danced with my dad a lot. That was a good time. Yeah, it was really fun. And getting my dad to go to a wedding in Mexico is like not what you would expect because he's not that
had
guy.
fun. Yeah, you could tell.
And he went and he had a blast. Yeah, it was good. So I got to spend some time with my extended family from Bolivia, which I haven't seen them in a really long time for obvious reasons. And it made me want to learn Spanish. So now Jess and I are both on our Duolingo journeys.
Duolingo is an easy app. Just kidding. It's not an
Yeah,
app.
this is not an ad, but I actually do like the app.
I love it. It's like fun.
If you're dipping your toe into learning a new language, it's good.
It is good.
While we were at the wedding, I realized that there are broad swaths of my family that only speak Spanish.
Yes.
And it made me feel like an asshole because I'm walking up to my aunt who lived in Bolivia for her entire life. And I was like, I would really like to be able to communicate with my family members. So yeah.
I have this problem, and maybe you have it too. Like, I can understand a lot more than I can myself say.
Yeah.
Because in the moment, I forget how to conjugate verbs, or I'm like, ugh.
Yeah.
But I know what.
You get really panicky.
Yes. And then
Yeah.
you just say nothing. So
Yeah.
that's what I'm really focused on is.
I have too. And we're keeping each other accountable, which is important.
We do 15 minutes every day.
Yep. And we're on a 8-day streak?
I think it's 9 now. Or I might have started
9
a
now?
day ahead of you.
You may have started a day ahead of me, yeah,
Because
but
then I was like, learn Spanish. And you were like, done.
sold. I already wanted
love
to.
it.
Yeah. So
Yeah.
so we're on our Spanish learning journey. That'll be great.
And that's all our updates.
Speaking of babies giving birth, let's do this.
Oh, yeah. Okay. So with literal birth approaching, for me, not for just everyone. Oh, I mean, do you? Sydney and I wanted to do an episode on like fertility, IVF, and what is ultimately like assisted reproductive techniques. Sydney shared that terminology with me, which made the journey for myself and Michelle possible. So as always, shout out to science.
Thanks, science.
Thanks, science.
I love that. For sure.
I love science. And we're going to cover really the history of IVF, which is in vitro fertilization. But we're also going to cover a bunch of other stuff, a bunch of other things that go into a fertility journey or the assisted reproductive techniques that you go through. I can speak a little from my experience, but Michelle and I really just chose one way.
Yeah.
There's like several ways for you to engage and embark on that. So it goes back like over half a century. Let's talk about what it is, like the terminology today. So we'll get into like what goes into it today, and then we'll go in like back in time.
Yeah. Also, before you jump into that, shout out to Jess, not only for sharing in this episode a ton about your own personal experiences, but also you put this entire episode together, and I think it was really well done.
Thank you. I had a spurt of energy, and I said, what should I do? Laundry or this episode? And
Podcast.
I chose this episode.
Yeah. Yeah. Well, I love it, and I think everybody else will too.
Oh, thank you. Well, you did work on this too, so shout out to Sydney.
Fairly.
Often people will just say IVF, and they'll like lump in IUI, all the other reproductive techniques together, and they'll be like, oh, I'm doing IVF, when actually they're not.
Yeah.
There are several distinct procedures we're going to talk about them. Broadly, they're part of what's called the assisted reproductive techniques.
Mm-hmm.
So what is IVF? IVF is a complex series of procedures where mature eggs are collected from ovaries and fertilized by sperm in a dish. This is like the in vitro term. It means in glass.
Mm-hmm.
Then that embryo or the embryos, the zygotes, are transferred to a uterus. This process can be medicated with stimulants for the uterus or non-medicated, and just like on your own cycle. But the egg retrieval requires a ton of medicine shots.
Mm-hmm.
It's like contraceptives actually also are involved. Like there's a ton.
Yeah.
So let's get into the types of fertility processes that people can use on their journeys.
So first, if you go to a physician for like a fertility evaluation, some of the things that may include are number one, blood work. This is almost always guaranteed, and that makes a lot of sense when you think about what you're trying to do.
Right.
In
It's
this
like the first step.
Yeah, exactly.
They're going to be like, great, give me your 6 vials of your blood.
Give
like,
me your
literally.
blood, maybe pee in this cup. Yeah.
Yeah. Yeah.
But that's basically guaranteed. So they're going to use that to check for hormonal abnormalities or potential genetic factors that could be contributing to infertility. They're going to use this to check your ovarian reserve and when or if you ovulate using your progesterone levels. That's a hormone that they're checking for. They can also check via your hormone levels, your thyroid function and your prolactin levels, both of which can disrupt normal ovulation if they're too high or low. So hormone work is really important. Ultrasounds are the second. Those are almost always guaranteed as well. They're going to use this to check the number of small follicles in the ovary, also known as the antral follicle count, to check the uterus and the ovaries for abnormalities such as fibroids and ovarian cysts also, which I think can contribute to fertility issues that people might be having.
Yeah, and just a trigger warning for people who might have undergone trauma. That ultrasound is often like a vaginal ultrasound. So it's not like on your stomach, it's like internal.
Yeah.
So just keep that in mind. If you, like that's something that my first appointment I was like, oh, okay. Like we're doing I didn't know that it was gonna you say ultrasound and you think like, oh, over the
belly wand thing. Yeah.
No, it's like a vaginal one.
Yeah, there's a lot of the whole thing is going to sound really uncomfortable.
Yeah, but it's so important. Like the vaginal ultrasound that I did, story time, like showed that I had polyps in my uterus that I didn't know and you don't know about.
Sure.
And they ended up having to remove them before we did our transfer because they can actually disrupt the egg or the embryo like implanting.
Oh wow.
And then they also tested them just in case. Like they weren't cancerous, but they could be.
Yeah.
Right. So they removed them, but they wouldn't know that unless they had done that specific type of ultrasound.
Yeah. Okay. So that's really important for sure.
Yeah.
That's good to know. Thank you for sharing that for sure.
You're welcome.
I don't know why I said that so serious. Like I already knew the story, but
yeah. Yeah. It was actually the scariest part of my whole experience was having those polyps removed.
Yeah, it's really stressful. And I feel like
I had never gone under anesthesia.
Right.
That's the other thing.
Yeah.
So I was like,
but I feel like hearing your personal stories is really good because I feel like a lot of this stuff is so stigmatized.
Yeah.
And not talked about in a normal way. And it's almost like hush hush. Like if you're going through IVF, people are weird and it's taboo and like it shouldn't be because it's super we're going to talk later about some stats and how common it is, but it's like super common.
It's actually very hard to get pregnant naturally. Yeah. So if you can do that, you're a superhuman.
Good. Congratulations.
Yeah.
Because it's really common to need help.
Yeah, exactly.
So number 3 is semen analysis. If you have a partner with semen or you are using sperm that hasn't undergone testing, you're going to use this to determine the number, shape, movement, all that needs to be normal in order for the semen to travel to the egg and do its thing there. Number 4 is HSG, also called a hysterosalpingogram. I practiced that, if you could tell. And that's going to help the doctor check for any blockages and show the path leading through your fallopian tubes.
Yeah.
Tell us about it.
I did
You
this.
did this.
Yeah, I did not like this. It is a painful procedure.
Okay.
Essentially, like what my experience was like is that they put a dye
Mm-hmm.
into, like, with the scope into my uterus, a blue dye, so they could see it. The cool part is, like, you can see, boom, all of the tubes, all of the everything was fine.
Yeah.
But because they do it through your cervix, and you're not, they like almost force dilation a little bit,
Eesh.
so it feels like you're having, like, they're like, oh, this kind of feels like a contraction, and
Great.
yep. Mm-hmm.
That's aggressive.
Yeah. But you could, it was uncomfortable,
Yeah.
to say the least.
Every single like diagnostic procedure here or clinical procedure that we're going to talk about sounds at minimum uncomfortable, at maximum like painful.
Yeah, it was not a great time.
And then number 5 is a diagnostic hysteroscopy. So the purpose of this is to check your uterus for any potential like structural abnormalities that could be contributing to infertility. And I looked this up because I was like, I have no idea what this even looks like. There's a lighted scope that looks like basically a long stick tube,
Mm-hmm.
and it's inserted into your uterus through your cervix to view the inside of the uterus in order to like check the structure of the inside.
It's kind of like what they do with the colonoscopy.
Yes, but it goes through your cervix.
But for your, yeah.
And that sounds real uncomfortable.
I would imagine they would put you out for that.
I would hope so.
Yeah, they told me for the polyp removal, I could choose whether or not to be out.
Why would anyone stay awake?
I was like, oh, put me out.
Give me everything that you can ahead of time.
Yeah, literally. So those are all possibilities. Most of them are required, really. But like, what is IUI, which is intrauterine insemination, and that's different from IVF.
Mm-hmm.
This is generally the first step of recommendations in a fertility journey for people who have this option, specifically for people who
Mm-hmm.
are choosing to use like a person's egg and like a sperm sample versus like IVF.
Right.
Like for Michelle and I, was we used Michelle's egg and our like sperm donor, and then I'm carrying. So like that's why IVF worked for us.
Right.
But IUI is like cheaper, significantly so.
Yeah.
And for people who have like regular cycles that they can track and they can still use medication, and then like a sperm sample, right? So
Mm-hmm.
sperm in this procedure is placed directly in the uterus to bypass the cervix and place the sperm closer to the egg, and it basically increases the chances for creating an embryo. So instead of being like, you do this at home, put your feet up, good luck.
Right.
They like time you exactly to when your egg is like going to be there.
Yeah.
And they're like, come to the office at like 10, you need to be in the chair at like 10:26 a.m. on a Friday. And then they put the sperm as close as possible
Yeah.
to where the egg will be so that it increases the chances for fertilization.
Right. Which makes a lot of sense if you think about it like logistically. Egg drops, if the sperm is right there, great.
Yeah, it's great. It's less expensive, but not always as successful. It only has about a 10% chance of success per cycle.
Yeah.
But it does increase the number of healthy sperm that reaches an egg when ovulation is occurring. So there's a reason why this is like the first step also, because IVF is like a lot more intrusive.
Yeah.
This is more like pretty simple
Mm-hmm.
here. And then you have to, like, if you are someone who needs to buy sperm from a sperm bank, you have to buy like several vials because they use like one
Sure.
at minimum, but they like to use like two, I believe,
Oh.
for each, and they're you pay per vial for your sperm.
Okay. That's good to know.
So,
Unless you have like a sperm guy.
which some people do.
BYOS. Bring your own sperm.
Yeah.
Yeah.
But if you're purchasing it, this is where it can get super pricey.
Sure. That makes a lot of sense.
Then there's this process called IVC, which is intravaginal culture. And I didn't know about this.
Mm-hmm.
I'd never heard of it. But this is when the egg and sperm are placed in a device, and the device is positioned in the vagina for fertilization and incubation. After the incubation period, the doctor removes the device and transfers one or more embryos into the uterus.
I've never heard of this before.
I was like, what is this? This has like a 25% success rate per embryo.
Huh.
So again, you're increasing your chances 10 to 25%
Right.
because of what we wanted to do. That's not something like we talked about, I guess. But in this process, fertilization and incubation occur in the actual body of the person who will be carrying the child.
Yeah.
For all of these processes, you go through a ton of testing, right? Ovarian reserve testing to understand the quality of your eggs, semen analysis if you need that. And because IVF is not a uterus owner's situation only, and like fertility is not a uterus owner's situation only, you do like disease screening.
Yeah.
You do a practice transfer. You do like all these exams. And I really like that it, like my research included like the sperm analysis, because oftentimes like sperm have like broken tails or something. And that's actually the reason
Yeah.
they're not getting pregnant.
Sure. There's lots of different reasons that that people have fertility issues. And all of those are relatively low tech, the ones that Jess was just talking about, which is not unsurprising because about 50% of the assisted reproductive technology that people use today are considered low tech. That can include hormone therapy, artificial insemination. So Jess talked about IUI. There's also a version of this where basically you probably have heard it kind of disgustingly called the turkey baster method,
You could do it at home.
where they basically take sperm into a pipette or a turkey baster or something and inject it directly into your vagina.
You can literally have sperm shipped to your house.
Right, right. And some people choose to do that, which is like more power to you. However, sperm meets egg, good for you.
Right.
And then there's IVF, which has about a 48% success rate. I saw, number one, these success rates are defined in clinical data as live births per cycle.
Right.
So I saw this get higher in some sources because there have been lots of technological advances in recent years. And we should also say that as the maternal age increases, the success rate does decrease marginally, which is also the case for basically trying to create a pregnancy of any kind. That's not really a secret, right?
Yeah. There's a clock. People say there's a clock.
There's a clock. Unfortunately, it
There's
sucks.
a clock.
I did see that IVF was recently used in someone to successfully carry a pregnancy to term that was 66.
Yes. It's like if you're
Everybody's journey is different. More power to you.
everyone's journey's different, and like my eggs could have been trash and it wouldn't have mattered because we weren't using them.
Yeah.
Michelle had like Michelle's like very fertile.
Mhm.
Michelle had a lot of eggs.
Yeah.
And my uterus like was like, I'm ready.
Right.
And we have been ready.
Yeah.
So it just like we had the right combination, but there's so many things that you can do to like prepare. Like I have a friend who even did a medicated IVF transfer. It didn't take, and then did an unmedicated one, which then she also paired the unmedicated cycle with acupuncture, and it took.
Oh, fascinating.
And it's just like things just happen like that.
Your body is complicated.
Yeah. Your body
That's
is
all there is.
complicated. That's the end of the episode.
Yes, that's the that's the name of the episode for sure. I feel like in movies and stuff, they always try to make pregnancy seem like it's something that happens super easily and naturally and whatever, and it's just not always for everybody. So
No.
at the start of an IVF cycle, there are hormones to stimulate the ovaries to produce eggs, as many as possible. In order to stimulate your ovaries, you might receive an injectable medication containing a follicle stimulating hormone, FSH, a luteinizing hormone, LH, or a combination of both. These medications stimulate more than one egg to develop at a time. So you probably know this, but if you're born with a uterus and all the equipment to produce eggs, then you're born with all of the eggs that you are ever going to produce in your lifetime. They're already there. They just have to mature and basically drop down.
Fun fact, if you are carrying a biological female as a baby, you're carrying already your grandchildren because the eggs
That's so weird.
are already there. Isn't
That's
that
so weird.
If your
Yeah.
child chooses to have children in that way, then you're
Yeah.
literally carrying the eggs that could be your grandchildren.
And the average number of oocytes is like 40,000. So if you're carrying a biologically female child, you have like 80,000
You are
oocytes in you at any one time. That's weird.
right. And that's why hormone levels in people who are carrying like biological females are so
Oh,
high, and
interesting.
they often have skin issues. There's
Oh,
like
okay.
all this stuff because you're so many more hormones.
I've actually heard that from a lot of people who have had daughters. They say like when you're carrying a girl, you can tell because it's like way worse on your body.
Mm-hmm. Yes.
Yeah. So that's an old wives' tale, but also it's true. Do do do. Okay, so that process is called ovarian hyperstimulation that we just talked about, where you're stimulating your body to produce more than one egg at a time. And that typically requires about 10 days of injections, depending.
Yep.
So that is like a process.
Yeah.
When your follicles are ready for egg retrieval, with tons of monitoring, you'll know exactly when that is, but it's generally between day 8 and 14. You take HCG or human chorionic gonadotropin to mature those eggs. That's called OI or ovarian induction. And typically, you're going through weeks of ovarian stimulation before the eggs are ready. And you know through this vaginal ultrasound and blood tests.
You literally know, like, to the set, like, they tell you, take this shot at 7:02 p.m. and you need to come the next day for retrieval at
Yeah.
8:03. Like, it's
That's
literally
crazy.
that specific.
It's so precise now. Yeah. I mean, which is awesome.
It's
It's
great.
making this a lot more convenient. And
Yes.
so for the egg retrieval, you are sedated. They take a probe to identify follicles, and then a thin needle is inserted. What I saw the term is transvaginally.
Mm-hmm.
So basically through your vagina to retrieve the eggs through your cervix. The eggs are then removed from the follicles through a needle/suction device. This involves like an ultrasound guided needle that pierces the vaginal wall to reach the ovaries. And that process takes between 20 and 40 minutes, depending on how many mature follicles are being retrieved at a time.
Mm-hmm.
And Michelle went through this.
Mm-hmm.
Do you want to talk about her experience at all?
I'll just say, like, her part of this experience, like, this egg retrieval was much more difficult than the implantation process.
Okay.
Because you're pumping your body. I think she had over 30 shots in like
Wow.
in 2 weeks, like, and we're giving them at home.
Yeah.
It was just it's a lot on your body, and you could feel it. Like, she could feel the difference.
Yeah.
But she was great after the like retrieval. Like, they put you under, and she's like amazing, and then you feel great, and especially because she had so many eggs. Like, we were super lucky.
Yeah.
But I will say her process was on her, like, in a short amount of time. It was like multiple shots a day.
Yeah.
And you can't like work out. There's like increased risk of like twisting your tubes. Like, yeah. So I will just say, people who have their eggs retrieved, like, that's a hard process on your body.
Yeah.
Yeah.
It's intense. Yeah, for sure.
Yeah, it was like a lot. It's a lot. So if you have a partner who's going through that, like, be extremely sensitive
and supportive. Yeah.
And supportive, because you do not understand. Like, I went through a different process, and I'm happy to talk about mine in more detail, but I felt like hers was much harder.
Yeah.
Like, physically on her, even though I had shots for I had like over 100 shots.
Yeah.
But I just had one pretty much a day. She had 2 to 3 in a shortened period. It was just, it's
in a really condensed time. Yeah.
Yeah, it was a lot.
Yeah.
If you are using partner sperm, a semen sample needs to be provided at the doctor's office the morning of the egg retrieval. So this can be done through masturbation or testicular aspiration, which is the use of a needle to extract sperm. And I didn't know about that.
I didn't either.
That sounds terrible.
Also, who would choose that one?
Well, I guess that's part of some of the problem, right? Is that they're not getting
I've heard of this.
Good enough sperm. But that sounds terrible.
I don't want to say the word ejaculation, but I think I'm going to have to. So one of the things that I've heard is that there are parts of your body for some people who, like, when you release sperm through ejaculation, it damages the sperm physically.
Yep.
And so in a case like that, I guess, is when you would need something like testicular aspiration.
Sounds terrible.
But that sounds terrible.
Yeah. Donor sperm can be used as well, of course, and that's when you like purchase the sperm, and we just had ours like shipped to our fertility clinic.
Mm-hmm.
So we never like received a bucket of sperm. And that comes fully tested. Like, you know so much about
Right.
like the sperm.
The person and the sperm, yeah.
Yeah, you know a lot.
Which is cool.
It was cool, I think.
Yeah.
After a period of time, you may have the opportunity to have the embryos hatch, quote unquote, and then you can do genetic testing after 5 to 6 days when the embryos mature to blastocyst to that stage.
Mm-hmm.
So we were like, hell yeah, let's like do genetic testing. We already have these like hatched embryos, which basically means that they're of better quality.
Yeah.
And then you test them and you really get to see like what's the likelihood of them like sticking, implanting, growing. Like they tell you a bunch of stuff with that.
Yeah. I want to talk a little bit more about the genetic testing because I went down a rabbit hole for this.
Good.
So you may have heard of it called pre-implantation genetic diagnosis or pre-implantation genetic screening. It's a super cool and useful procedure that they now can commonly use to determine which embryos have the highest chances of producing a successful pregnancy, which is really cool.
Super cool.
It can also be used to rule out certain inherited diseases.
Yep.
Most commonly, some of the ones that they're looking for are cystic fibrosis, sickle cell disease, spinal muscular atrophy, Huntington's disease, and Charcot-Marie Tooth disease. So I think that's amazing. Some people have ethical issues with certain aspects of this.
Mm-hmm.
And as I was reading it, like, I get what they're saying technically, but I feel like it also does a ton to reduce human suffering.
Yep.
And a lot of people really benefit from it.
Yeah.
So keep that in mind. Do some research if you're interested. I just wanted to jump down that rabbit hole a little bit because I feel like, I don't know, I feel like people get morally a little bit weird about PGD, and I feel like there's no reason to for the most part. Some people use it for things like family balancing because you can choose the sex of your embryo if you want.
Yeah.
I don't think with modern science there's anything wrong with that.
It's not like you're like picking like I want my child to have blue eyes, like give me all the blue eyes
Right,
and
exactly.
throw away the rest of them. It's more like
Exactly.
the way it was described to us was this is testing that can help you ensure successful pregnancy.
Yes,
And
exactly.
That's the key. Like that's what you want.
Right.
Especially people who
Also-
are at that point, right?
Yeah. Also, like, no disrespect to anyone who has like Huntington's disease, but I think if you could choose for your child not to have that, you would much rather
Yeah, you'd want to
have that be the case.
Exactly.
for sure. So,
Great job. Great rabbit hole.
oh, no worries.
For fertilization, there are generally two methods. There's the conventional insemination, which mixes healthy sperm and mature eggs overnight,
Mhm.
or intracytoplasmic words,
Mhm.
science words. Sperm injection, ICSI, where a single healthy sperm is injected into each mature egg.
Yeah.
Then you have the transfer. This is done at a doctor's office or clinic for IVF.
Mhm.
You may have a mild sedative. I did turn up because I was stressed. They were like, ma'am, you need to relax.
Sedate me always.
And it really helped. The procedure is painless. Like the
Mhm.
transfer, the embryo transfer, you can like be awake and your partner can be in the room. And
Oh,
like
that's so
you can
weird.
like watch them transfer
Yeah.
the embryo. And we did, yeah.
Mhm.
They insert like a long, thin, flexible tube catheter into the vagina through the cervix. Nope, into the cervix through the vagina.
Yeah.
The cervix comes after
Yeah.
the vagina in biology, people. And then through into the uterus, a syringe with one or more embryos is suspended in some fluid and it's attached to the end of the catheter. And then we saw this like being transferred into the room too. It's like very cool.
So interesting.
And then the embryo is placed in the uterus, and 6 to 10 days later, the embryo will hopefully implant into the uterus, and that's when you have like your pregnancy testing.
Mhm.
There are side effects of any procedure. typical side effects could include passing a small amount of like clear or bloody fluid shortly after the procedure
Yeah.
due to the swabbing of the cervix before the embryo transfer, breast tenderness due to high estrogen levels, because if you do a medicated, especially if you do a medicated transfer, bloating, cramping, constipation, and then they told me I couldn't like take a bath or go into a pool. So just keep that in mind.
That makes sense, I guess.
Yeah, that makes sense. Yeah.
But all of those side effects sound kind of terrible. None of this is like a super comfortable process, but I'm glad we're covering this because I think infertility is super shockingly common
Yep.
and it's often a weirdly taboo topic.
Yeah.
But according to the CDC, about 1 out of every 5 people trying to conceive a child are unable to do so within a year. And that's the window that they consider infertility.
Yep.
10 to 30% of infertility cases are considered unexplained. They usually have a suggestion of what's causing these, but like you literally, it just may not be working and you don't know why.
Yep.
So needing fertility assistance is super common. And this type of assisted reproductive technology has helped all kinds of people build the families that they are dreaming of. So I think that's really cool, and I'm super glad that we're covering this.
Yeah.
As part of your fertility process, you could also have surgery to correct medical conditions to give you a better chance of a successful pregnancy. Some of these surgeries might include a laparoscopy, which can be a diagnostic tool. It involves the insertion of a small lighted camera into your pelvic cavity, which allows your doctor to check for things like scar tissue, endometriosis, blockages that impact the fallopian tubes and ovaries. If there are any issues discovered during this, you might need an additional surgical tool to correct the problem. We talked earlier about a diagnostic hysteroscopy, but there's also an operative hysteroscopy in where they use this basically long tube to remove any tissues or growths that may be interfering with fertility. That can provide a view of fibroids, scar tissue, polyps, like what Jess was talking about, and abnormalities inside the uterine cavity. Anything to add there?
Yeah, I had that done. Yeah. And I was like, oh my God, but it was fine.
Okay.
And like the other thing that matters too is to know that all these things just happen.
Yeah.
Like when my doctor was like, oh, you have a little polyp there. I was like, oh my God.
Mm-hmm.
He was like, no, like almost everyone has.
It's super common. Yeah.
Like they just are there. The only reason I guess they could see like 1 or 2, but when I went under, he was like, "Oh, you had like a lot of little ones." Like not a lot, but like maybe 4.
Yeah.
And he was like, "We just took them all out." And it's not because they were like doing anything wrong per se.
Right.
And they also could have been removed naturally through like your period, through the shedding of the uterine lining. They could just naturally come out.
I didn't know
But
that.
they only remove that kind of stuff just to increase the chances of a successful implantation.
Right.
So after that happens, you like let everything heal. So you have that done.
Yeah.
You're like, oh, I've been waiting forever, right? And you have to wait more, but it's actually to make sure your uterus is like pristine.
Yeah.
And like in the best place to like embed the embryo.
Yeah, that makes a lot of sense. And I feel like, I don't know, this is super common. I feel like the reason that we need to talk about it more is because society really pressures women. And so much of that is on your like ability to have kids and your desire to have kids and things like that. And I feel like talking about how common these things are is so important because there's so many people that struggle with this.
Yeah.
So
it's like just your body. Like your body does stuff like we don't know.
Right.
Like how should you know?
yeah, and it's a personal journey that I feel like people really like to get up in your shit about.
Oh yeah.
But
People
it's
be
about you
asking
and your body and what's possible for you.
Especially like as Michelle and I have discovered, people get real asky. They're like, how are you having a baby?
Yes.
Like, you and this woman.
Right. They want to know everything about it.
Which is fine. Like for someone like me who I will talk about on this podcast, right? I don't really care.
Right.
But like not everybody wants to answer all these questions.
Right. People get really intrusive for sure.
Yeah, people do.
So keep that in mind. But also, it's like, it should be an open topic to talk about fertility issues because it's so freaking common, but also
Yes.
when this is a personal journey, stay out of people's shit.
Yeah.
Sorry, we got way off topic here, but
Woof.
I love that tangent. I'm glad we had it.
Me too.
Number 3, another type of procedure is a myomectomy, and that refers to the removal of uterine fibroids. It's sometimes called a fibroidectomy. And then a laparotomy is number 4. If a minimally invasive procedure like the laparoscopy is not feasible, then your doctor may recommend this. It's a major surgery performed under general anesthesia on an inpatient basis, meaning you will be spending a little bit of time in the hospital, but it's basically to do the same things, make sure that you're ensuring the most successful pregnancy possible.
Yeah. So there's all the medical stuff. Now let's get into the history of how we got to where we are now with like all these options.
For sure.
And the story starts with Walter Heap, who is a doctor and a professor at the University of Cambridge. Not anymore. I said is, but was.
Was. Yeah.
Who was doing research on reproduction in animals. And he reported the first successful embryo transfer in an animal in 1891.
Which is crazy.
It's kind of crazy. It's also like, sir, weren't there other things you could have been studying at the time? Like,
I mean,
like, anyway, other doctors and scientists followed suit with Gregory Goodwin Pincus and Ernest Viences attempting to perform IVF in rabbits. So rabbits were like, they multiply really easily. So people were like, oh yeah, let's try these rabbit situations. That resulted in a pregnancy at first, but then later it was discovered that the pregnancy started without the assistance of IVF or like any of their procedures. They were just rabbits having rabbit babies.
Having rabbit sex, yeah. Rabbits are super fertile, so maybe not the best subjects.
I know.
Or maybe the best, I don't know.
Medical researchers first identified female fertility hormone estrogen in 1923. In 1929, they discovered progesterone. These are like really important hormones for fertility. So
right.
In 1943, yes, that's the word. Okay. In 1943, hormone supplements were developed, which is crazy.
It is crazy. I actually read a little bit more about this. Progesterone therapy has a ton of really cool uses.
Yes.
But it is really hard to come by naturally. So they tried it in animals and in like people donors, and they were like, there's no way we're going to get enough of this to treat a big population of people. And then in 1943, there was this chemist named Russell Marker at Penn State who figured out how to extract progesterone from wild Mexican yams.
These are crazy yams.
Big old yams make progesterone, and you can extract it and like commercially produce it from these yams. It's a super interesting story, and they started basically using it immediately after that for hormone therapy, which is cool.
And I will say I was on progesterone. I had over 100 shots of progesterone.
Mm-hmm.
The shots sucked, but I felt great on progesterone.
Yeah, you were like, give me them yams.
Give me them yams. Like, IVF was used in the 1950s, via medical testing and observing animals. In 1959, the first birth of a non-human occurred through IVF. And in 1978, the world's first baby conceived by IVF was born. Now IVF is a clinical treatment which assists couples to create families that they want to all over the world. But that's crazy. Like, it feels like in 1978 is like a long time ago, but like also it's not. It's
not that long ago when you think about it. So John Rock was the first to extract intact fertilized eggs. In 1948, Rock and Miriam Menken retrieved over 800 oocytes, and 138 of those were exposed to sperm in vitro.
Those are some brave people.
I'm so glad you said this.
I would not have volunteered for that process.
I would not either. Okay, imagine, like, it already feels really intrusive and painful now. Imagine what it was like in 1948.
Hell no, I would not have.
No, same.
Nope. Big nope energy.
They published those findings in the American Journal of Obstetrics and Gynecology. Following that, Anne McLaurin and John Biggers published a paper about how they had grown mouse embryos in vitro and then transferred them into female mice, which was a huge landmark paper at the time.
Imagine doing like mice and IVF. Like, that's weird. Like, it's so tiny, tiny, tiny IVF.
It's teeny tiny and very weird, I would guess. So then the first pregnancy using in vitro methods in humans was reported in The Lancet from Monash University in Australia through the team of Carl Wood, John Leeton, and Alan Trousson. This was completed in 1973. The pregnancy did not last to term, so they called it a biochemical pregnancy. Steptoe and Robert Edwards started work on human IVF research in 1968. And then in 1977, they carried out a pioneering conception, which resulted in the birth of the world's first baby to ever be conceived by IVF. Her name was Louise Brown. She was born July 25th, 1978, in Oldham General Hospital in Greater Manchester, United Kingdom. She's celebrating her 44th birthday this year. So just to put into perspective how new this technology is, the first baby born via IVF just turned 44, which is wild.
Literally.
Yeah.
So 78 days after the first IVF baby was born in England, the second ever IVF baby was born in India after a really interesting Indian researcher and physician independently developed a method.
Yeah.
In the late 1970s, a physician from Kolkata, India, Subhash, Sydney's going to help me with the last name.
Mukhopadhyay. Looked it
was
up.
performing his own experiments. Yeah. Shout out to Sydney for always knowing the words and me for never. So Subhash was performing his own experiments with instruments and a fridge, like on his own, which resulted in a, quote, test tube baby. We don't like that term, but at the time that was like accurate. That's how they described it. Named Durga, who was born in October of 1978. State agencies prevented him from presenting his work. So he was like not recognized by international science communities for what he accomplished for a long time until recently.
Which sucks.
Yeah. During the 80s, IVF would become much more mainstream, probably because it was like, what is happening?
Yeah.
By 1986, over 1,000 children were born via IVF. So times a changing.
For sure.
Since these like huge achievements, science has really made advancements in the field, right? We now have stimulated cycles.
Yeah.
With all these medicines, HCG to control the time, and time egg maturation, which is like a huge part of getting all the eggs out and making sure they're ready to actually be like made into embryos with sperm.
Right. Another step forward in using IVF as a clinical treatment was the discovery that gonadotropin-releasing hormone agonist, GnRHA, could be used to control and time oocyte maturation, which helps a lot with fine-tuning the time of collection. And that decreases the need for monitoring by preventing premature ovulation. So it's like Jess was saying, this basically enabled them to time it like you need to be in the chair at 8:03 a.m. and we'll do the egg collection. Yeah.
Literally, it's like that.
In addition to the use of the oral contraceptive pill, which allows for the scheduling of IVF cycles, that makes treatment far more convenient for both staff and patients because you can decide when things are going to happen. In 1983, Alan Trousson and Linda Moore reported the first pregnancy that used a previously frozen embryo. And while that one wasn't carried to term, that ability improved the feasibility of IVF significantly. And then in December of 1983, the first baby was born using this method, and they were actually twins. And then in 1986, Christopher Chen reported the first pregnancy with frozen eggs that was carried to term. Frozen sperm had been done for a while, but this was totally different and allowed people with eggs to undergo, like if they were undergoing radiation for cancer or menopause, and still have children using their own eggs afterward. And sidebar, we should absolutely do an episode on freezing your eggs because, number one, we had a listener actually ask for that specifically, but also it's just a really interesting topic. Egg donation is another step in the process. In 1983, the first pregnancy occurred through egg donation. And in the U.S., the first child born from egg donation was in 1984. So the 80s were a huge time for this, and it's only been getting better and easier and safer since then.
Yep.
Obviously, there's a lot to know about IVF, fertility, all the information that we've provided here. The procedures are constantly being upgraded, but we think it's really beautiful that families can be created from partners exactly how they want it to be.
Yeah. It's a whole thing, but now you know. You know more than you did before.
For sure. We hope you love this episode, and that's what we know about that.
And that's what we know about that. A reminder, we are not putting out episodes in May. Don't be mad. It's fine. We'll put them out in June. We'll be back in June. If you have a recommendation for an episode you'd like us to cover, you should DM us on Instagram, Malpractice Podcast, or email us, malpracticepodcast@gmail.com.
If you like what we're doing and we're giving you valuable information, don't forget to leave us a review wherever it is that you like to listen to podcasts. Happy almost mom time to Jessica.
Happy almost mom life.
Right. So
That's
thank
great.
you for your patience with us during these big life-changing times. And as always, don't forget, malpractice makes perfect.
Bye.
Bye-bye.